Okay, so good afternoon to all IEM and UEM family members. Again, we are meeting after a break of 3 days on a Monday. So the today's topic, as you can see, uh, right now, due to this COVID, this yogic techniques, this meditation, yoga, physiotherapy has become an essential requirement in everybody's life. So this aim to impart yogic techniques which can benefit us all to fight the COVID-19 virus should be a very, very interesting topic. Now it is by Dr. Sapna Malla from University of Engineering and Management, UEM Jaipur. Dr. Malla is a physiotherapist herself, so she can definitely describe this very well. So you're hearing from her means you're basically hearing from a physiotherapist that what techniques you can use so that our body is ready to fight the virus. Now, let me tell you that in our UEM Jaipur, there is a physiotherapy course, BPT course, and this course is a very, very popular course in the northern part of the country. Maybe in Bengal, this course is still not, I should say that people don't know too much about the course, or that is not too popular a course, but in northern part of the country, there is a huge demand for this course. And believe me, in this BPT course, the requirement of physiotherapists with this 4.5 years degree, not a physiotherapist with a 6 months or a 1 year training, the physiotherapist with 4.5 years degree, who actually studies all the courses that come under MBBS, everything. So these physiotherapists are needed in a big number, and the demand for these physiotherapists are much more than what should I say, the number that is produced. So this course has got a huge demand. Anyway, so this is not the point. The point is Dr. Malla will be talking about this yogic techniques. I will request all of you to see this, and maybe this will help us a lot in fighting this pandemic. Okay, so madam, it's all over to you. You may kindly take over from here.
Okay, thank you, sir. Uh, Good afternoon to all of you. First of all, I would like to thank our Chancellor Sir, VC Sir, UEM and IEM family members and my colleagues for giving me an opportunity to present my topic in front of you. My topic is aim to impart yogic techniques which can benefit us all to fight the COVID-19 virus. As COVID-19 scare grapples the whole country, people are getting concerned about their health. While practicing a good hygiene, the one thing we can really do is to look for the ways to boost the immunity naturally. And yoga is the only way which we can naturally uplift our vitality, and yoga has been used for centuries in keeping the body functioning fit and fine. Before I start my topic, I want to ask you one question. What was our first act when we came in this world? I repeat my question. What was our first act when we came in this world? And what is our last act when we go from this world? I am giving you 30 seconds. You can write your answer in one word in the chat box. Again, I repeat my question once. What was our first act when we came in this world? And what is our last act when we go from this world?
Okay, so that's an important question, and she expects the answers in the questions box. So you can write your answers. I will still request madam to read the question once more because it is not showing on the screen. Your question is not there on screen. So I request you to kindly read out the question once more.
Okay, I repeat again. What was our first act when we came in this world? And what is our last act when we go from this world?
Okay, so expecting all to answer. Getting few one-word answers, getting a lot of one-word answers in the question box. So you tell me when to start reading out the answers.
Sir, after 30 seconds, you can tell me the reply.
Okay, so 30 seconds from now. 30 seconds means maybe 25 seconds from now. Okay, so I think 30 seconds are over. So let me very quickly try to read out the answers. Professor Arindam Chakraborty, sleep. Professor Smita Datta, breathe. Professor Somnath Hajra, breathing. Professor Arun Kumar Chatterjee, cry and sigh. Professor Arijita Das, cry. Professor Anubhav Goswami, cry. Professor Shukallan Goswami, breathing. Dr. Anurupa Maharaj, breathing. Professor Shantanu Ghosh, interesting, nothing at all. Okay. Dr. Subroto Chattopadhyay, peace. Ruma Roy Chaudhuri, breathe. Shobhik Roy, breathe. Jyoti Khandalwal, crying, first act. Respiration by Dr. Shomik Gangopadhyay. First act, cry by Shayantani Chaudhuri. Jyotirmoy Haloi says, breathe in and breathe out. Trying to breathe, Shetadri Ghosh. Dr. Arnab Ghosh, breathing. Mandar Chakraborty, breathing. Nilanjana Chatterjee, crying. Sujata Bose, crying and excelling. Mental Wellness by Monami Chaudhuri, Cry by Bhavravi Ghosh, Breathe by Srijita Bose, Breathing by Anubhav Roy, Cry and Sleep by Indranil Basu. So I can see first act is to cry, last act close eyes, Parthopal, Benazir Rahman says cry, first act cry, last act smile, Ankur Vishwas, cry, Praloy Kumar Skor, healthy body, Ankit Kumar Sharma, Abhijit Kargupta says to be happy always, be healthy always, and do not involve in any unwanted things before leaving the world. Okay, fine. Now, Ratul, they crying Yoga Pleasure by Vishwadip Chaudhuri, Development by Dr. Shaktipada Nanda. What was the last dash dash dash? Did not understand the word. Anyway, by Srimanundi. Cry by Shubhendu Banerjee. So there are. You can understand. Many people have done. If there is any other answer, I will just read out. Otherwise, there are maybe 100 more answers. So some other answers like Life by Shaugato Ghosh. Any other question? Right and Left by Sanjay Mondal. What does that mean anyway? Uh, okay, I'm trying to find out any other answers if think possible. Nothing by Vaibhav Varshni. We'll try anyway. I don't understand this. Shumit Paul. So respiration by Showman Nandi. I think we had that answer also. So breathing, crying, respiration, these are the main thing. Okay, Kaustav Mondal, addition of body, mind, and breath. Okay, so these are the things. These are the answers that have come in the questions box.
Okay, thank you, sir. Absolutely, our first act in life is breathing in, and our last act of life is breathing out. We can survive. We can survive without food for some days, or without water for some hours. But without breath, we can't. We only survive only for few minutes. So breath is a life. Without breathing, we food is to exit. How we already know how breath is important. So when we practice yoga, we should follow the proper breathing pattern. Then it can be effective. Why yoga is important? Because if we practice yoga regularly, it reduces the stress systematically in the body, which in turn cuts down the inflammation and degeneration. And it also recharge our body, get our body free from the toxins, impurities, release all the negative energy from our body, keep ourselves positive, and also keep our vital organs to function normally. It offer a great deal of wellness and support for your body and mind as a whole. Today, we will discuss some yoga techniques which we can try to recharge our immunity and cut down the risk of danger. So, first technique is the pranayam. Pranayam, it can act as a simplest and the effective way to boost the immunity and positive energy into your body. By practicing pranayam and paying attention to your breath, you can boost of the immunity of your body and easily bring the mind from unpleasant state to a pleasant state by enhancing and regulating the life force that is known as prana in the system. How to perform this pranayam? You should sit in a comfortable position with leg crossed. Keep your spine straight. Your left hand should be placed on the knees and then inhale deeply. During inhalation, stretch your spine as much as you can and then slowly exhale. Stay in this position for at least 10 minutes and take deep long breaths, 10 to 15 deep long breaths. It also normalizes our heart rate and also benefit our immunity and releases all the stress from our body. Second technique is the Kapalabhati Pranayama. It is also very effective pranayam because it helps in digestion and it also improves the lung capacity. It clears the mucus in the ear passages and relieves congestion and also clean the subtle energy channels, and it also improves the blood circulation and refreshes the brain and calm your mind. This pranayam is very much effective if the person is suffering from any respiratory related problems like asthma, bronchitis, pneumonia, COPD, etc. It also keeps our immune system strong. But this pranayam should be avoided if the person is suffering from epilepsy, high blood pressure, in females shortly after the pregnancy or during the menstruation cycle. How to perform this pranayam? First, you should sit in a comfortable position. Your spine should be straight. Close your eyes. Place your hand on the knees and your palm is facing towards the ceiling. You can also keep your palm in the mudra position also. First, you should exhale completely, then inhale normally through the nostrils. During exhalation, you should pull your navel in toward the spine and allow your belly to expel all the air from the diaphragm and the lungs. As the navel and abdomen get relaxed, breath will flow automatically into the lungs. This pranayam is very much effective if we practice this pranayam early in the morning for at least 10 minutes daily. Second is the BHASTRIKA pranayam. When we do any physical activity, our body demands more oxygen, which signals the heart to pump faster. When you do BHASTRIKA, you pump even more quantity of oxygen. In this pandemic section, if we need instant oxygen, then this pranayam will be very effective. It also energizes our body and the mind. It maximizes your lung capacity, remove all the toxins and impurities from your body. It also helps if the person is suffering from any sinusitis problem, bronchitis problem, any other respiratory related problems. Also improve your awareness, perceptive power of senses, and clear all your doshas, vata, pitta, and kapha doshas. It also clears the doshas. It is a process of rapid inhalation and exhalation which gives a boost to the body. This pranayam is very much effective if we practice this pranayam in kneel sitting position, or we can say it in Vajrasana position. If he or she cannot sit in the Vajrasana position or cannot sit on the floor, he can do this pranayam by sitting on the chair also. First, you should sit in a Vajrasana position. Your spine should be straight. Make a fist. Make a fist. Fold your arms, placing near your shoulder, and take normally 2 deep breaths first. Then Inhale deeply. During inhalation, you should raise your hands up, straight up, and open your fist. And during exhalation, you should exhale forcefully and bring your hand arms down to your shoulder and closes the fist. Do 15 breaths and three sets of the repetition. This is a very effective pranayama. Apart from this, you can also do Brahmari Pranayam, Ujjayi Pranayam, Mudra Pranayam. They are also very effective to increase the immune system. Now we move on the asanas. There are so many asanas which help us to boost the immunity. First asana is the fish pose, or we can say it Matsyasana position. It is basically an elevated pose which detoxify you and boost your energy channels. It can also up nasal passageway and release the congestion. How to perform this pranayam? First, you can start from the lotus position. You can start first with elevate your head slowly and raise your chest. When you raise your chest, make sure that it should be in relaxed position. Shoulders should be kept easy. Arms should be wide. Palm is facing upwards, and legs should be crossed or in extended position also. Stay in this position for 2 to 3 minutes. You should maintain this position for at least 3 minutes and take deep 5 to 7 long breaths for maximum benefits. Next asana is the NAUKASANA. We can say it boat pose also. It boat pose, it also strengthens the abdominal walls and improves the health of essential organs, thereby helping the purify blood flow and eliminate all the toxins and waste products from the body. A good functioning digestive system benefit the immunity in the long run also. How to perform this asana? First, you should raise your head upward, shoulders away from the ears. At the same time, lift your toes up. Arms should be straight. Maintain this position for 2 to 3 minutes and feel the stretch in the navel area. When you maintain this position, you take normally 5 to 7 deep breaths, and again after 3 minutes, come back to the normal position. It is one of the easiest way to regenerate the immune system. Apart from this, you can also do Sarvangasana, Setubandhasana asanas, uh, Merudandasana, Parvatasana. They can also very effective to keep your body fit and fine. By practicing pranayam and asanas and paying attention to your breath, you can boost up the immunity of your body, easily bring the mind from unpleasant state to pleasant state also. Think you are fit enough? Here is a test for your family. Here is the simplest way to test your fitness. You can get your family members to take this test to make sure they are doing their best to keep themselves fit as well. The test is divided into the 4 parts. First is the 1 mile run test. In this test, we include uh, running, jogging, or normal walking to check our cardiovascular ability. Second test is the sit and reach test. This test will check our flexibility. Third test is the push-up test and crunches test. Do some rounds of push-ups, do some rounds of crunches to check your core strength, and they will also help you to gauge your fitness level. Last technique is the meditation. Meditation is nothing but go deep into yourself. Meditation will help you to keep your mind calm in peaceful state, balances your body both emotionally as well as physically. It also keep you free from the stress, and it also reduces the symptoms if the person is having any anxiety problem, any respiratory related problems, asthma, if or if the or cancer patient is having, the person is having cancer, chronic joint pain, taking any antidepressant drugs, heart diseases, high blood pressure, sleep problems, tension, headaches, then meditation will help them to overcome all these problems. Meditation, you should start with 10 minutes and then gradually increases the time up to 15 to 30 minutes. If the person is, because most of the person is suffering from sleep problems, insomnia, I should suggest them, you should follow the Yoga Nidra meditation after the meals. And it is this meditation, Yoga Nidra meditation, is easily available on the YouTube channel. You can also follow the other meditations like guided meditations, mantra meditations, etc. But in this pandemic session, if you want to keep yourself free from the stress, if you want to keep yourself full time energetic, you should practice meditation at least twice in a day. Work from home, we already know work from home is the only way we can protect ourselves from COVID-19 and also complete our work, and sedentary lifestyle is become a habit now for everyone. We spend all of our day to our laptop screen and just manage to take meals in short breaks. This often lead to body stiffness, back pain. What you need to do in order to avoid that situation is to take regular breaks in between. And in the breaks, you can do simple stretches like, first stretch is the standing side stretch. In standing side stretch, you should stand straight on the ground with your feet together. In first step, you should raise your arm upwards, clasp your hands together, then stretch your spine as much as you can, and uh, take 5 to 7 deep breaths and again relax. In step 2, you again raise your arm upwards, clasp your hands, and then bend on the right side. And feel the stretch. Hold this position for a few minutes and take deep long breaths. And again come back to the position and do and repeat this procedure on the alternate side also. Second stretch is the back twist. For back twist, you should stand straight on the ground and let your hands should be loose. Now twist your back from one side, hold this position for 2 to 3 minutes, feel the stretch and take some deep breaths, and then again come back to normal position and repeat this procedure on the left side also. This back twist will relieve all the stress from all the stiffness from the back and reduces the pain also, and will give you enough energy to get back to the work. Next is the core stretch. For this stretch, you should stand straight on the ground with your feet together. Now, first bend your left leg or right leg backwards. Hold hold the feet with the hand and stretch it for a few minutes. Hold in this position and take normal deep breaths, and then again return to original position and repeat with another leg. Apart from this, you can also do shoulder stretches, elbow stretches, neck stretches, etc. At last, I want to share my last 7 to 8 year experience of practicing yoga daily early in the morning for 1 hour and meditation twice in a day. It keeps me strong and helps me in various ways. So I suggest you to practice the yoga daily, not only in this pandemic session, but after when this pandemic session get over, you should make a habit to practice a yoga daily in the morning to keep your body fit and fine. Even you can also even you can also teach your children some simple yoga techniques, because we already know COVID third wave affects the children. So if we teach them simple yoga techniques in the pranayam like Bhastrika pranayam or Nadi Shodham pranayam, teach them some stretches like neck stretch, shoulder stretch, elbow stretch, wrist stretch, and in asanas also teach them child pose, cat camel pose, setu bandhasan, etc. This will help them to protect from the COVID-19. That's all. Uh, Thanks for listening me patiently. If you have any query, you can write in the chat box.
Okay, so should I shoot the poll now, madam, before the question, before reading out the questions?
Yes, sir.
Okay, so I have launched the poll. I would request people to answer maybe within 1 minute maximum. So I will wait for 60 seconds. We have reached up to around 30% votes, 35%. I expect at least 60% votes. So we have reached around 30 seconds. We can wait for 30 more seconds maximum. So we have reached 50% votes. I expect at least 60% votes to be reached. So around 15 more seconds we will wait. 10 more seconds to go. We have reached 52% votes. Okay, so it's 1 minute over. We have received around 55% votes. So let me close this and share this. So I've shared the poll. I expect all of you can see the results. So 58% goes for pranayama, 31% goes for meditation, 10% for asanas, and 1% for kriya. So we can say 58%, 31%. These are the two main things, pranayama and meditation. 10% with the asanas. So your comments, madam.
So, thank you, sir. I suggest you, when you start doing practice yoga, first you should start from the simple joint rotation movements. Simple do joint rotations, whole body rotations from head to toe. Then move on the asanas. Do some asanas, 5 to 10 minutes, and then go for the meditation, and then in the last go for the kriya. Then it will be very effective for you, because when you start from the joint rotation or some asanas, it releases all your stress, and it will help you to go deep into the meditation.
Okay,
Thank you, sir.
so thank you, madam. There are maybe one or two questions. So first question from Professor Proloy Kaur. He asks, is Bhastrika Pranayama suitable for high blood pressure patient?
Sir, this pranayam should be avoided in high blood pressure patient because it leads to hyperventilation. So we should avoid, or if we want to do Bhastrika pranayam in high blood pressure, we should exhale normally, not do forcefully at that time.
Okay, so that was a good question and a suitable answer. Professor Shobhik Chattopadhyay requests you to share the PPT in the group. It will be of great help. Nice presentation, Sanjay Mondol and many other nice presentations are there. Question from Dr. Lata Rani saying, how often and for how long should we do the asanas?
So, ma'am, you can practice asanas for 10 to 15 minutes and hold the position in every asana for 2 to 3 minutes. and feel that stretch.
Okay. Okay, so again, few comments like Professor Madhusudan Vaidya says, thank you for your advice in this pandemic situation. Professor Srima Nandi has got a question. What pranayama is required for spondylitis?
And you can also do all these pranayam, Nadi Shodhan pranayam, and also Ramri pranayam, also Ujjayi pranayam. Also, you can also do that.
Okay,
Whenever you do pranayam, it will also reduces your stiffness, pain. If there is any stiffness or pain in the neck region, it also reduces.
okay. So good. That was a good question, and also there is one question which was answered last day. So again, your comments. Is it necessary to do yoga and pranayama in the morning, or we can do at any time during any time of the day?
Definitely, sir. I suggest you, if you practice yoga and pranayama early in the morning, it give you energy for the whole day and keep you fresh, keep your mind fresh, keep your brain in calm state, in the peaceful state. So I suggest, if you don't get time in the early morning, then do in the evening, but at the time of 5 to 6 p.m.
Okay, so thank you, madam. There is this question was from Professor Jay Prakash Pandey. Okay, Professor Joydeep Roy has got a question. Madam, which pranayama is effective for increment of memory power and concentration power and time?
Nadi Shodhan Pranayam, or we can say it Alom Vilom Pranayam.
Okay, so that pranayam was described in your PPT.
Sir, repeat the question.
Did you describe that pranayam in your PPT?
No, sir, I did not describe that pranayam. I
So,
simply
Mhm.
I simply tell you that how to do that pranayam. First, keep your two fingers between your eyebrows like this and place your thumb on the right nostril. First, exhale completely through the left nostril, and then when you start when you start inhalation, then press your right nostril with your right thumb and take deep breath from the left nostril. Hold it with your middle finger and then release your release and exhale from the right nostril.
Okay, so thank you. That was a good demonstration. I believe you understood. If not, you can always write a mail or communicate to him. Maybe we can
Sir,
share your email ID. Yes.
I want to tell you, I want to tell all the faculties, you should practice yoga pranayam. It is possible only if you first take commitment with yourself. I should practice daily, then it is possible. It is my guarantee. If you practice daily for 30 days without any break, you should practice daily yoga, then it become a habit. If you skip for one day because of your sedentary style, then it cannot be effective. So I suggest them to first commit yourself and then practice the yoga to keep your body fit and fine. And if you think you cannot do this yoga practice alone, I suggest you to practice this yoga techniques with your family, with your friends. In this pandemic session, you can also join various online classes, online yoga classes. Even I also take yoga classes daily 1 hour. You can join all those classes to keep your body fit and fine. Thank you, sir.
Okay. So Professor Monami Chaudhuri asks, Madam, is it okay to do yoga along with 45 minutes exercise twice daily?
Twice in a day. If you are in stress, then you can do 45 minutes, but in 45 minutes you include all the three techniques: pranayam, asanas, and meditation. All the three techniques will include in the 45 minutes.
Okay. But she was asking that she does 45 minutes exercise twice daily. Is it okay to add yoga to it?
Yes, sir.
Okay. Okay, Madam Gauri Mojumdar has got a question. She is
Meditation.
interesting again. Feel good to see a question posted by Madam Gauri Mojumdar. She is one of the oldest person in this in IEM group. Maybe joined one of the members. So we feel good to see her question. She asks, if we do yoga in empty stomach, is there any problem which can arise in the body?
No, sir. If you want to do yoga in the empty stomach, you can take only 2 to 3 glass of lukewarm water, because if you take lukewarm water, it also releases all the toxins from the body and waste products from the body when you do practice, when you do yoga. So you no need, if you take your meals, then if you want to do yoga, then take some gap, 2 to 3 hours gap, then you can practice yoga again. Avoid yoga after meals. Only you can do meditation after meals, but don't do yoga after meals.
Okay, thank you, madam. So thank you for the session. It was definitely useful, and I thank all the IM and UEM family members for being here. It was really a good session. Thank you. Thanks to all of you.
Thank you, sir. Thank you so much.
Thank you. Hello everyone. I am Professor Dr. Vishwajoy Chatterjee. I am the Vice Chancellor of University of Engineering and Management, UEM Jaipur. Today I am going to talk to those students who want to pursue a career in medical but somehow did not have the opportunity to pursue MBBS. Now question is there any alternative? There are several alternatives, but I am going to talk about a special alternative which is BPT. And the speciality about this alternative is that in this profession, physiotherapy, which you become a physiotherapist after completing a course of 4.5 years in BPT, you can write a doctor in front of your name, followed by a PT at the end. I repeat, BPT or Bachelor of Physiotherapy is a 4.5 years degree course, 4.5 years degree course, where after completion of this, you become a doctor in physiotherapy. You can write a doctor in front of your name, followed by a PT at that end. It is a wonderful alternative for a medical profession. If you want to be a doctor, then this is a wonderful profession, wonderful option if you are having some problem not to pursue MBBS. Let me tell you that a physiotherapist has got some advantage over the other medical professions that you can think of. Immediately a profession that may come to your mind is nursing. You might think, I can also intend to study nursing as an alternative of medical profession, alternative of MBBS. But remember, in nursing, if you become a nurse, then you don't become independent like a doctor. A physiotherapist can open his or her own chamber where a patient can directly visit without being referred to by a doctor. Whereas in case of nursing, you become a nurse where you need to work under a doctor, either in a hospital or in his or her own chamber. So that is the advantage of having a course, a degree of physiotherapy. Nowadays, you can see around, there are several chambers that are opened by physiotherapists where people visit normally without being referred by doctor. People do have problems, who have orthopedic problems, who have other problems. They directly visit the physiotherapist and remain under a physiotherapist under long treatment. You can understand that this course or being a physiotherapist is of immense opportunities, of immense advantage at that time. Now, I would like to also tell you that being a physiotherapist, what are the career options that you might have? See, you can become a sports therapist. You know that in sports, physiotherapists are needed continuously with sports person. You can become a sports therapist. You can become a physiotherapist with your own chamber, which I have already mentioned. Several hospitals, or if not all, needs a lot of physiotherapists and keeps a lot of physiotherapists because it normally says that in an operation, whenever an operation is done, a physiotherapist must be involved in it. As a result, the different hospitals have got enormous number of physiotherapists in it. As I said, you can have your own chamber. Then the other option that is possible is a public health official. You can go for a government job and you can become a health officer. Though this job is partially admin, but you get more and more responsibility with seniority. So these are the several options that you have. Comes the respect. If you say, are the physiotherapists given the same respect as the doctor? Yes, I can write doctor in front of my name, I can put a PT at the end, but are the physiotherapists given the same respect? In some other countries, I have seen that the physiotherapists are given more respect compared to the doctors, only because of the reason that physiotherapists treat without medicine, whereas doctors treat with medicine. Without medicine, you are treating a patient and treating him and making him absolutely fit for regular life. So that is the beauty of this course. I will invite all of you to come to this course, join this course, and if you talk about some other points in physiotherapy, that is also there. I can tell you some other point which I had noted down, like hospitals, as I said, need physiotherapists in ICU, IPD, OPD, and definitely there are several options in sports therapy, government jobs, as I mentioned. Now, the course name is BPT, and I invite you all, if you are interested in this course, then you might call in the given phone number 9887313330 for my university, which is University of Engineering and Management, UEM Jaipur. If you are interested, you call in this number and you can enroll for this course. You get the opportunity to become a doctor in physiotherapy. I will invite all of you to come to this course. Our university has got several tie-ups with several hospitals all around. They do a lot of internships, our students. They get involved with the hospitals right from the beginning. Right from the beginning of the course, they become involved with the doctors, they become involved with the hospitals, they spend their time in the hospitals, they learn. So these are so many options that you get right from the beginning. Apart from that, our students are continuously involving themselves in medical camps. They conduct frequent medical camps where patients come and they treat the patients directly during their student tenure. When they are students, they are doing this so that they get the practical exposure and become professional when they actually get the opportunity. So these are the several options, and one more thing I missed out is in our university, patients directly come. We have got a hospital associated with us in our campus where patients directly come for physiotherapy and the students directly get an option to treat those patients under the supervision of their teachers who are doctors. I invite you all to UEM Jaipur, University of Engineering and Management, UEM Jaipur. You can note down the number 9887313330. Till this situation is over, the situation of crisis COVID-19 is over, the entire course is possible to be conducted or taken in online mode. Till the situation is over. Thank you. Thanks to all of you. Note down the number 9887313330.